working with the Jason Foundation, I've seen an exponential increase in the amount of people we've been able to touch and lives we've been able to help through their observations and the work with youth and families. Clark, do you want to tell us a little bit about the Jason Foundation?
Sure. First of all, let me tell you how proud we are to be here as the Jason Foundation and myself. The Jason Foundation is 25 years old. We all turned 25 October 1st, so we have our anniversary coming up. It started, of course, on July the 16th, 1997. It was July the 16th, 1997, that I lost my youngest son, Jason, who was age 16 at the time, to suicide. At that time, I owned a insurance company. We were the average upper middle income family. Had the house overlooking the lake, the dog, the suspicious cat, all those things. Two good boys. Life was good until that July 16th time, and that's what really changed our family and really was the start of the Jason Foundation. I had a good friend ask me, did I really understand what happened about losing my son? And I went on my old Radio Shack computer and I typed in youth suicide. First thing came across was third leading cause of death at that day and time for 15 to 24-year-olds. That's when we had the idea to start the Jason Foundation. As a parent, I'd went to every PTO, PTA, every church meeting about drugs, alcohol, even a form of bullying, but no one had ever brought up the incident or the threat that youth suicide would have upon my family. So I wasn't prepared. I didn't know the warning signs. I didn't know what to do if I saw them. So we started the Jason Foundation with the idea of providing parents with this information, how to recognize, how to respond. We've grown quite much from that time. We operate on what they call the triangle of prevention, and I think that's important on any program. The CDC says that for any program that affects youth, you've got to have it from three angles. You've got to have programs that affect the young people themselves. They see the changes in their peers way before anybody else. Educators and youth workers, in my opinion, one of the largest, most impactful groups that we can touch. Then the third group would be parents themselves or community parents. And you have to have all three enabled to have a really good prevention program, no matter what you're trying to do, whether it's bullying, smoking, drugs, or suicide prevention. You've got to have programs hit all three. The Jason Foundation addresses it that way.
The reliance is now spread throughout the community, essentially.
It has to be. Yeah. It has to. If you're going to have the best prevention effort in a community, we're lucky we go in, like with our HCA affiliations. And when we go into these communities and we talk, we say it's important not just to do this training, not just to do this teacher training, not just to bring the curriculum in for your students. You need to have all three areas, because if you don't, you're letting one area down. You're letting an area get by that can really rear its ugly head. And as we talked about, I know we're going to talk about it, with the COVID and the after COVID, or what we're going through now, how it's hitting and resulting on mental health, I think we even have to be more vigilant and more in tune.